One. My name is Caitlin Blanco Silva, and I'm the CEO of the Palmetto Employee Assistance Program. And Annalyn, if you want to introduce yourself.
Hi, everybody. I'm Annalyn Barnett, and I am Vice President of Business Development at Youturn.
And welcome, everybody. Today, we're going to be talking a little bit about some of the trends and statistics that are going on with substance use during the pandemic. And then we're going to talk about some solutions for that. So I'm going to go ahead and jump right in, talking a little bit about substance use and COVID-19. And so just like, you've probably heard a million different times, this is an unprecedented time. We've seen changes in all different types of fields and all different types of situations that we're in. And this is really having an impact in the workplace. And we are seeing it as Palmetto EAP. All right, so what is COVID affecting? All aspects of work. There's constant updates about the risk and the death toll of the US. Like, I know that I'm getting up in the morning and checking the numbers. I had to stop doing that. I had to stop checking the numbers of how many cases that we had because it was causing more anxiety. There have been major changes at home and at work, especially with school starting. Virtual schools, coming to work on half days, people being stressed about financial fears and threats that they may lose their job. There's changed global mobility. I know certainly it affects my family because if any of my husband's family in Spain gets sick, we can't visit them. We can't care for them because we're not able to travel over there. Again, that goes right into the fear of infecting loved ones and not being able to see family members. It balances between the fear of losing job and returning to work. What's the safest way to return to work? So who wouldn't be anxious and depressed? And I always, in a lot of my trainings, I've been telling people, listen, nobody is doing okay. Nobody in the whole wide world is doing okay right now. So just to validate the feelings that you might be having when it comes to COVID and the pandemic. So here are some of the numbers around employee assistance profession and what we are seeing. We have seen, and every company is different. Every company, from our hospital, of course, has their major challenges, to our county agencies, our city municipalities, all the way to our car dealership. We have a lot of different plans and transitions that are unique to each company. And these are difficult. So we have certainly seen a 30% rise in utilization. That's the national numbers for EAP. But that's also, we've got in Palmetto EAP, we have about 16%. And I'll talk to you about that in just a second. Also, when you transition, if you have people that are working from home, transitioning to this virtual only construct has really pushed people to feel like they're working all the time, that there's no sort of break, there's no stopping point during the day. I certainly feel that too when it gets to be 6 o'clock and it's like, oh, I gotta do dinner. I don't have to think about my commute. That was something different when I started working at home. It was like, I have to section out some time for commute home to get the kids on time. But then now I'm at home, I'll just work to 6 o'clock and be like, oh my gosh, dinner. So 31% reports poor quality of sleep, 30% increased levels of anxiety, 24% report poor mental health. So these are the increases that nationally EAPs have seen. A lot of anticipatory anxiety around returning to work. And it's difficult. I've seen that it's very difficult for companies to really set policy and standards around the expectations in the workplace. People are looking for that. Work is one of the ways that we, that as humans, we feel less anxiety when we know what to expect. And the workplace is one of those places that usually manifests that security, right? You go to work every day, you know what your job is, you know what to expect, you know how things are going to run. having this return to work with all of, well, we might have to wear a mask, but we're not going to wear a mask over here. And this is, and you can't sit next to each other. And all these different rules have really increased that anxiety when it comes to returning to work. We're also seeing isolation, depression, risks of suicide have gone up. Increased alcohol use and prescription meds have increased. Prescription meds in two ways. One, of course, we have an opioid epidemic, what we'll talk about in a minute, but also two, prescriptions for depression, prescriptions for these mental health situations have gone up. So the normal prescription that you would get to help with these things has also gone up. Again, presenteeism and engagement. It's hard to adjust to the new work environment and really engage. So what is EAP? We are here for consultations. We are here to guide productivity in the workplace. We are here to help employees stay focused and to deal with some of the outside issues that can affect the workplace. Our mission is productivity and increasing productivity. We do this through consultation, training, self-referral, management referrals, informal referral, and just basically being that bridge to accessing treatment and accessing counseling and accessing a full holistic wellness package. So EAP has increased 5% of our records in substance misuse. So when we adopted a electronic data system to make sure that we're collecting this type of data last year. So we started collecting this data. So the time from the beginning of the pandemic until now, we have seen a 5% increase in substance use from this time last year in our data. So people with substance use disorders are at higher risk. So if the person already has a substance use disorder, they're going to, during the pandemic, have less access to treatment, a higher risk of getting COVID because of their physical disposition, because of the substance use. And the general stress, so somebody without a substance disorder is already feeling depressed, isolated, anxious. The person with a substance use disorder is also going to be feeling that on top of their substance use disorder. And so there are multi-directional relationships between economic distress, this has been studied, unemployment, recession, psychological distress, and substance use. So we already know that substance use increases when these types of things are happening. And we can tell that these types of things are happening right now. So we are projecting, the National Safety Council is projecting an increase of substance use. And our data shows it as well. So the big question is, okay, what are the numbers? What are the numbers around substance use, opioids during the pandemic? And really, I can't come and give you the black and white numbers because we've got I have a hand raised. Thank you. Let me finish this slide real quick and then I'll answer that question. So we have, we don't have a definite answer of exactly how many people are overdosing, exactly how many people are developing substance disorders because of the pandemic. Those types of numbers are going to come out as we go. But we have numbers behind patient data, and we are making the predictions that these things are linked, that overdoses are increasing. And we see that in the media. The studies just haven't backed it up yet. So going back, what the numbers that we are seeing, the studies that we are doing are showing that there is an increase in substance use and important consequences, non-fatal, but there's a greater effect in disadvantaged populations and specifically the Black community. So and that kind of projects along how the deficits in our the way that we provide medical services, it goes along with the same thing that's happening with COVID, it's happening with substance use. So disadvantaged populations that don't have a lot of access to medical help are also disadvantaged in getting treatment help as well. So that's where you're going to see your increases. So I'm going to tell you a little bit about the epidemic. If you don't already are not familiar with the epidemic, I think I've probably been dealing with the opioid epidemic for most of my career at this point. But in 2018, see, 2018, these are our big standard numbers that we know. 10.3 million people aged 12 and older reported opioid misuse in the past 2 years. 67,000 Americans died from drug overdose in 2018. And less than 20% of adults who needed treatment for substance disorder received treatment. Okay, so that's really what we're talking about here when it comes to the pandemic is access to services. 95% of fatal opioid overdoses occur in working aged adults. So if you feel like this is not something that hits, your workplace, understand that 95% of the fatal overdoses were working aged adults. And if you think about the unemployment rates, and I used to talk about this before pandemic, but the employment rate was really low. So chances are the people who are using substances are also employed. Because a lot of times we think that these people are not. So, all right. So drug poisoning is a category that includes opioid-related overdoses, accounts for 56% of off-the-job fatalities, and that's from the National Safety Council. Anytime you have questions about substance use in the workplace, go to the National Safety Council website. They have tons and tons and tons and tons of resources. Again, so what we're doing is the studies are projecting that because of access to treatment, because of the problem of getting these people to treatment as they usually would do because of the pandemic, we do expect that we're going to see life-threatening increases in overdoses and opioids during the pandemic. And that's mainly dealing with systems issues. Okay. All right. So here's some changes that have happened in treatment. And this is something that's happened within Palmetto EAP. So the federal government, because of the pandemic, allowed confidentiality restrictions to be loosened around telehealth services. We had telehealth before, but as things started to shut down, we increased our telehealth by 80 to 90%. At least in Palmetto EAP, so that our customers and our employees were able to access treatment from their homes. So they didn't feel, and our counselors were also protected from the virus as well. And this continues. So what this has done has really created a situation in which we are seeing that access can be provided through telehealth, and also the expansion of things like the expansion of Medicaid. If people are able to have the access to insurance, then they can access these platforms. But these platforms are also cost effective. And so it's easier for people to access counseling now that they have lowered those restrictions on HIPAA and increased the use of telehealth. And I will tell you that telehealth has the exact same evidence base as seeing somebody in person. Okay, so it is just as effective and has the same efficacy. So again, a lot of the stuff that we talk about with the pandemic has to do with normal stress that has increased and has affected substance disorders. We also talk about access, who has access. But as long as we continue to get the information out there that people do have access through a telehealth platform, they're able to access some of these prescriptions like Narcan and methadone and Suboxone and types of things that can really help with opioid overdose. So in saying that, there is hope, and the hope is in innovation and adaptation. Okay, so we are, as Palmetto EAP, we are looking for all different types of innovative resources where we can connect people to services. And like we've done over this pandemic, it has been about adaptation, just as you've done in your workplace. How have we adapted? How have we continued to be productive and get our workforce going in the first place? And so, this report really talks about these restrictions being lifted on telehealth, these restrictions being lifted around access. I know that in policy, we like to think, oh, well, we've always done it this way. There's no way that we could ever do it differently because this way has always worked for blah, blah, blah. Well, this is an instance where we said, well, telehealth works. Okay. So talking about hope, talking about innovation, I'm going to turn it over to Anna Lynn because she has what I believe is an excellent innovation in accessing treatment, especially around substance disorders for substance disorders. And so I'm going to turn it over. I'm going to kick out my slides and let Anna Lynn kick in her slides.
This is what I look like, non-pandemic in real work clothes with real makeup on. As I said, my name is Anna Lynn Barnett, and I'm happy to be a part of the call. Caitlin's done a great job of talking about what's happened in the world, especially since COVID. But I think it's worth understanding that we had a problem with substance use and misuse even before COVID. So we weren't starting at zero. And the impact was already being felt by companies universally, regardless of size, regardless of industry. Substances were already impacting your company. Every single company, regardless of industry, and the impact is pretty significant. These are some of the ways that substance use disorder, either use or misuse, is affecting companies prior to COVID and even more so since COVID. Drugs and alcohol are increasing liability and risk with companies. There are higher workers' comp claims because of drugs and alcohol. People that are either misusing or abusing substances have 200% higher medical claims than those who don't. Higher prescription cost. Caitlin mentioned this earlier. It is not only are we dealing with an epidemic, an opioid epidemic, but more and more people are taking anxiety meds and things like that. And drugs and alcohol only make that situation worse. Obviously, employee retention is an issue. She also touched on absenteeism and presenteeism, where people are even dealing with the residual effects of a few too many cocktails, and they are in front of their laptop and working from home, but they're not fully engaged because, quite frankly, they're probably hungover. More companies are facing litigation because of drugs and alcohol. Prior to COVID, SAMHSA and other national organizations estimated that 8 to 9% of your current workforce is struggling with some type of substance misuse. Alcohol is still obviously the most popular drug in this country and affects the most people. And so in every company, regardless of size, there's someone that you may not even realize that is struggling with substances. There is another 18 to 20% of current employees who go home to some type of substance abuse in their homes every night. So you may have an employee that doesn't have any issues, but they go home to a spouse or to a child who's struggling. They're also going to have higher medical claims, higher prescription cost. So all of these play into the costs that companies are currently paying that they may not even realize they're being affected by drugs and alcohol. This does not even take into account what your company brand and your culture is worth. All it takes is one episode, whether it is a company function where someone has a little too much to drink or a inappropriate comment is made, and that can not only cost your company in litigation issues, but is also going to change your culture, and who knows the impact it would have on your company brand. I mentioned earlier on that we wanted to be disruptive in the marketplace. Youturn does not have, we don't subscribe to some of the traditional myths about how to help people that are struggling. First and foremost, we don't necessarily believe that rehab and treatment is the only path. Interestingly enough, that helps less than 13% of people. And 40 to 50% of people who at any point in time indicate they might have had a struggle with substances have been able to self-correct their behavior many times just with better education. We also don't believe you have to hit rock bottom. Substance abuse and any type of addiction seems to be the only disease that is treated that way. If you were diagnosed, if you had a melanoma or skin cancer on your face, and your dermatologist said, you know, I know you're a big sun worshiper and you love to go to the beach. I don't think you've learned your lesson. So I want you to spend a few more years going to the beach and baking in the sun. And then when you come back and this particular skin cancer has metastasized to your lungs, then we're going to treat you with chemo. You would think that is the craziest thing you've ever heard of. And yet that basic scenario is how we have traditionally dealt with addiction. And we felt like people had to learn their lesson and hit rock bottom. And more and more we're learning that that's not the case. We also don't believe tough love is the right way to help people that are struggling. We know that by better educating not only their families, but their coworkers, that helps create an environment where a person is much more successful on their recovery journey. We also recognize this is not necessarily a willpower problem, and we try to educate people on the changes to your body and your mind physically that happen as addiction progresses. Last but not least, a lot of people, if you tell them they got to attend meetings for the rest of their life, they're just not interested in that. And so they don't seek the help they need. So what are we and how do we work? Our vision is to create a premier platform of the most trusted educational content for recovery and community engagement around all types of substance use. And we do this by helping employees we help companies help their employees and the employee families. And by helping the family unit and the employees with practical addiction information and training, we can help improve the culture of the company as well. We do this in a video platform. So this again segues beautifully into what Palmetto EAP has really gone to with telemedicine. All of our content is available on a video platform that works on any device, any type of, any personal device, laptop, cell phones, you name it. We have over 300 videos that cover everything from education and training to personal stories. And our information is not just directed to a person who's personally struggling. We recognize that this is a much more ripple effect, and a lot of our content is designated for employers, human resource departments, spouses, children, people that are residually affected and touched by substance use. The big thing that is different about Youturn is our program is completely confidential. And what we know is as wonderful as services like Palmetto EAP offer employees, when it comes to substance abuse, alcohol, drugs, anything like that, there is still a huge stigma. People are hesitant to reach out. They are, especially with some of the clients, I know Palmetto EAP works a lot with law enforcement and the medical community. These people that need help are scared it's going to jeopardize their job. And if they have a loved one or a child that's struggling, there's still a stigma about substance abuse. And so what we want to do is provide a confidential platform and start the conversation and let people know they're not by themselves. that they have a problem that is all too common, and give them some hope and some direction so that then they can engage with their employee assistance program and get additional help. Another thing that sets us apart is while we provide this as an employee benefit, we encourage employees to share our information with all their family. Our approach is a little different. And I mentioned we were disruptive. We did not agree with some of the standard protocol in the past. So what do we agree with? We start with a motivational interviewing platform, and this has become universally accepted in supporting behavior change for all different types of health conditions. Traditionally, it's not been used as much in addiction, and we think that is not the right approach. We think that motivational interviewing is a much less aggressive, much more open. We have better engagement with people when we change the way we present information and engage them in conversation. We're more about strength-based messaging and pointing out gains versus focusing so much on the negative aspect. I know a lot of people who have been to traditional treatment, and that is a great, I don't want to poo-poo that at all. That's a great environment for certain people, but a lot of people feel like it's it is very much points out their weaknesses and their their shortness of character instead of focusing on their strengths. We are very non-confrontational and we don't use labels. So I've used the word addict in talking with you, but in all of our content, we don't use the word alcoholic or addict. We don't put labels on people. We're also really big on starting with harm reduction principles. And I mentioned that people are hesitant to get help. Number one, because of stigma. Number two, because the fear of never being able to have a drink, or if it's a drug of their choice, absolutely never being able to have access to that is too overwhelming for a lot of people. And because they think that's the only option, they don't want to take the next step to get help. We don't believe it is it has to be a 180-degree switch overnight. We believe that there are behavior moderations and steps that you can take. Ultimately, our goal if someone is struggling, it would be to get them to a complete abstinence lifestyle. But if that prohibits them from getting help and getting on the right path, we want to start with some baby steps and educate them that there's some things that they can do to get them there that won't be so drastic. And ultimately, our last thing is we want to change there are stages of change in both the environment, the workplace environment, as well as the family environment, where we want to help support change attitudes internally and externally, which again, just helps people on their recovery journey. Our content is over 300 videos. We've developed them all. And I feel like it's important to point this out, especially I know we have a lot of HR professionals on this call, and we've not found anybody that's delivering the content like we are. One of the things that I always hear is, oh my gosh, they're not stick figures or emojis or cartoon people. All of our content is custom created. We have a studio. We're based in Greenville. We shoot all of our own video in our studio in Greenville. And it's real people. They're real people telling real stories. One of our co-founders actually is a talented, highly decorated, for lack of a better word, trained therapist, interventionist, and counselors who fell into addiction after a car accident and walked out of the ER with a bottle full of painkillers. And in a very short period of time, he had a raging opioid addiction. And he learned so much about the process through his own personal journey. He also has been involved with rehabs, with other employment assistant programs. So he really understands how we all can work together. And he's the driving force behind a lot of our content. So our content's divided into 3 silos. I mentioned education and training as one. We also have personal stories and conversations. I want to go back to the education piece. We feel like one of the best services we can provide employers is a training platform on alcohol and drugs. Just like you train your employees on diversity, on sexual harassment, on safety, those are non-negotiables. You probably do them annually. And we want, you wouldn't consider doing business without incorporating that training. We believe alcohol and drug awareness needs to be part of your annual training as well. More and more, it's no longer a conversation for companies about if you have an issue around drugs and alcohol. It becomes a question of when. Over 60% of Me Too claims have been alcohol related. And companies, Google is a perfect example, who have literally have settled millions of dollars of litigation over alcohol related Me Too claims. So one of the best things a company can do is proactively address this issue. It is across the board. And by training your employees on it, you are helping to reduce the stigma. You are publicly saying, look, we know drugs and alcohol are an issue for everybody. It's only worse through COVID as people self-medicate and try to cope. And we want to address it proactively through a training program. We have a system where each employee would go online and do an actual certification that goes into their HR file every year. So some people only partner with us strictly for that risk mitigation piece, but we offer so much more than other traditional training programs. I mentioned also earlier on, we encourage, we offer our content as an employee benefit to employees, but we then allow employees to provide our access to any of their family members at no additional cost. In summary, I just want everybody to understand that every company has a problem with substance issues. You had it prior to COVID. It's only gotten worse in the last several months. And until there is an end to the world we're living in, if there is an end, it's only going to get worse. People, for all the reasons that Caitlin already mentioned, people are stressed out and they are trying to self-medicate. They're finding any kind of coping mechanisms they can. Substance misuse is a very slippery slope. So more and more people who never had a problem are starting to develop more and more dependencies, and it's only going to get worse. This problem is definitely creating risk in your company. Maybe if you weren't aware of it, you're a little bit more aware of that now. It's definitely increasing cost and affecting your bottom line. And no matter what you do and how large your company is, I guarantee you have employees and families that are struggling today. We can help face the challenge. We want to help reduce risk and cost and help your employees. And we can do this in a very easy format. It's user-friendly. Our goal is really just to start the conversation. This is a great time too for me to kind of segue back to Palmetto EAP and other employment assistant programs. We do not feel like we are any type of conflict of interest for them whatsoever. We feel like we are just a very good companion product for Palmetto EAP, because what we know is because of stigma, people are hesitant to reach out for drug and alcohol issues. But if we can start the conversation with them in a confidential atmosphere where they're given more information, they're better educated, whether they have an issue or someone they love does, then we can be a great bridge to bridge them to their EAP and help educate them on some of the great services that the EAP provides for them. And that's what's happened a lot of times. Many times when a company works with us, their employees will reach out to us directly. And that is a wonderful opportunity for us then to say, hey, you have a great EAP. Now's the time to engage them. So a lot of times we can kind of help bridge that gap and help bring people kind of full circle back to some of the great programs that EAP is providing. These are just, this is just an idea of some of the industries that we currently work in. I did want to show you this slide. I think this is pretty cool. I mentioned that some of our content is, well, all of our content is custom created. The, excuse me. These are some of the medical schools currently using some of our content. They are learning, they are trying to better educate nurses and doctors in the trainings where they're training them now on how to look for and how to talk about substance abuse. What we find is nobody ever seems to tell their doctor how much they really drink. And a lot of people don't realize that there are 49 chronic diseases that are directly tied back to alcohol use, but they're not coded that way. And so insurance companies aren't aware of them, employees aren't aware of them, but a lot of people don't realize that some of the health issues they have, like high cholesterol, high blood pressure, is directly correlates to their alcohol consumption. So a lot of our training protocol now is being used by some of these med schools. And this is just my contact information, how to get in touch. We have a very easy onboarding process, very low lift for companies. If you'd like to learn more about us, there's my email address and my contact information. I'd love to discuss with you further how we can help your company. So Caitlin, at this point, I will turn it back over to you and see if we have any questions.
Absolutely. So, all right, so it'll be us here. We're going to take some questions. We already have a question in the chat, and I'm going to answer that in just a second, but I did want to just add a few things just to kind of help connect where all this kind of fits in and how it smoothly works with an EAP. So we have different levels of entry, points of access for EAP. We have the self-referral, which is when somebody anonymously calls our line, we get them connected with a counselor, end of story. Then we have the second level, which is called our informal referral, which is the strong encouragement by a manager to an employee that they need to engage in treatment services. And then we have the management referral. And that is when, you know, we've seen write-ups, we've seen negative behaviors in the workplace. It's a safety issue. It needs to be taken care of. That's where we come in and we're providing that extra help, because of usually it becomes a safety situation or it becomes a productivity situation. That's what EAP do. And so where Youturn sort of fits in, because I find this is an issue, as I say, listen, people are using substances and they're not going to tell you. That's why we do random drug screens. That's why we do all these different measures, especially in our safety sensitive positions, to make sure that people are coming to work, you know, so that they can do their job. So what Youturn is really doing is going out there, spanning, getting people at many different levels, because the way that we treat mental health disorders, this is how we treat all mental health disorders. Today in the DSM-5, everything is on a spectrum. Okay, so it's not one size fits all for any mental health, right? You can come in at any point to receive recovery, to receive help. Like she said, you do not have to hit a bottom anymore. You don't have to let things happen for 2 years before you engage people. And so that's why we have these different levels broken out. And so what Youturn does is it educates people on that level of the self-referral, right? Yeah, you've got an issue. So we're gonna go ahead and educate you and see how you can access services at whatever level of the spectrum that you're on, so that you don't have to go all the way to the highest level. But that's what EAP does, is we're like the highest level, right? And we bring, you know, the management referral, because safety is really a concern, you know, but it is our duty to continue to have productivity and to continue to create a safe space and a confidential space for people to access services. So Youturn is a great companion to that EAP service. So let's go ahead and we'll ask some questions. So this will be the point where you guys can raise hands, put stuff in the chat, put stuff in the question answer, and we'll kind of go back and forth, and we might even ask each other questions while we're doing that. So let's kick it off with the first question. And I will read it out. What is the metric for success, and what is the success rate for the program?
And I will be glad to field that. I'm assuming that's about Youturn.
Mm-hmm.
Great question. So our model, there is I mentioned Rich Jones, who is our co-founder. He actually had started this model through what is called Favor Greenville. It's Faces and Voices of Recovery. And he started this model on a local level. And since 2013, when it was founded, they have successfully logged over 100,000 hours of coaching. They have helped 45,000 individuals and 10,000 families. That is really the brainchild for how Youturn evolved, because he was having great success in a local market, and he partnered with one of our other co-founders, who is an extremely successful entrepreneur who had struggled personally with substance abuse for years, and they realized this model worked, and now it was time to take it on a larger level. So our model is a SAMHSA model. It is a Department of Justice model, and it's been selected as a clinical trial for the National Institute of Drug Abuse. To answer your question on the specific matrix of how we are impacting companies right now, we're a relatively new company. We started last year. So we just now have started hitting some of the anniversary dates with some of our clients. We are tracking some of the algorithms as far as measuring how we're reducing healthcare costs and things like that. And I hope to have some specific information on that. Obviously, we have to give that some time. But we know we're in the success we have is in a couple different ways. Again, some people use us strictly as an additional insurance policy. They are training their clients on the risk involved with drugs and alcohol. We do have a client in town actually who unfortunately had an employee that overdosed. And the family is really having a hard time with their grief. They have come after the company personally and suggested that they created a party environment, and they are trying to, they have filed litigation against this company. Fortunately, the company is one of our clients, and they've been able to immediately say, absolutely not. We know drugs and alcohol are an issue. We mandate this training for all of our clients. And so that has completely helped take some of the steam out of what could be a very expensive litigation process. We do know that because of the track records that we've seen with Favor and the companies the individuals we've been able to help, we do know the success rate we have. Am I answering that question, Caitlin? I don't know. We're working on some specific matrix because we're a young company, but we know the model works because it's worked before, and now we're just taking it out onto a larger level.
Mm-hmm. Mm-hmm. Absolutely. And I know that I've been involved with Favor for many, many years, and have seen this new component, in the regards to the history of substance use disorders, where we really are taking a peer-led, peer support approach to the whole, what we call the recovery-oriented system of care, right? So we have prevention, intervention, treatment, recovery, and it goes around in a circle. And so recovery has a hand in all of those different types of pathways that people access substance recovery. So Youturn, Favor, and this integrated approach is new in itself it doesn't have the kind of, and it does have the history because it's always been a beer connection. This is the way that it really helps not just pigeonhole people into one certain peer direction. And it opens up so many different ways. Like I said, going along that spectrum, it opens up so many access points to accessing help. But whereas with the DSM-4, you have 4 ways that you can be a substance. You can have a substance disorder. And if you're not one of these ways, we don't really have a way to kind of treat you. So, and that has, with the advent of the DSM-5, opened up all of the mental health disorders to be treated at different levels. So Favor has done an amazing job at really connecting families, connecting people to recovery resources at whatever level and whatever participation and motivation that they have. And it's just like I said with the opioid numbers and the substance use numbers at this point, we just don't have the long-term outcomes, because substance use disorders are a tough cookie to put numbers on because they're in recovery.
That's right. And I mentioned to you before the before the webinar began, I have a lot of pre-COVID statistics. We have started to compile some COVID statistics as well, but I'm happy to provide that to you, Caitlin, and any of the attendees on the call, some very specific numbers from national organizations like the National Safety Council and SAMHSA about the cost of substance use and abuse. I'm happy to, I didn't want to kill everybody with death by data, but I'm happy to provide that as an addendum after the call. One thing I think that we do especially well that had not been done before is recognize that any type of substance use or misuse is a global problem. It's not just an individual problem, it's a family problem, and it's ultimately an employment problem as well. And we try to address a lot of that in our content. We have some specific modules for managers and human resource professionals about how to start a conversation. It seems that inevitably when there is an issue with a person within a company, whether that's any type of substance related, after the fact, everyone's like, well, everybody knew that so-and-so, worked hard and played hard, had a little too much fun. It's not a secret usually with that person. It's just never been addressed. And a lot of the times it's because people don't know how to address it. So we actually have some really good content for managers and for human resource professionals about how you start that conversation, how to have it in a professional way that's non-threatening, and just other resources for families. A lot of people don't realize the scenario of, say, the 60-year-old lady in the accounting department who does not drink or anything at all, but her beautiful Harvard-educated daughter is now hooked on opioids or some other substance and is living in her basement. And she's mortified, she's heartbroken, she's stressed out, she's blowing through her PTO by February. Every time you turn around, she's going to the doctor. Nobody can figure out what's going on. And it's because she has an issue and she just doesn't know where to go get help. So that's another key area that's costing companies more money, and we want to try to help with that.
Mm-hmm. I have a question for you, and it's kind of a question comment. When in my last slide, I talked a lot about innovation and adaptation, and I think that not just for COVID and not for the pandemic, also for generations, I think that we're really in a switch right now about how people consume content, how people engage with content. And I think that I'd really like to kind of hear more about sort of what that content looks like. So if I'm going to be a person engaging in this, what do I do when I pull up my phone? What do I do when I pull up my computer? How do I engage with the content?
Great question. Very, very easy. The way that we, and obviously, if a company chooses to work with us, we customize the rollout based on what works for their client. So we do everything from a step-by-step email. Here's the directions, but it's very easy. We send every company has a login code for their employees and a link to our platform. And when an employee logs in, then they can share that client code with their family, and all of their families can log in and set up a user ID that way. When you go in, it literally, we say, if you can operate Netflix, you can operate our platform. It's that easy. We have search modules, so you can search by specific drugs, relationships. You can type in college son beer, and it will go through all of our 300 videos and show you those that deal with that topic the most.
Mhm.
Our conversations are literally that. They're just a very relaxed scenario where people tell their stories, what happened to them, where they are today. It's very relaxed. It's very real. Everything from kids talking about their dad's drug addiction and the impact it had on them through their life, to mothers who have lost children to overdoses, to people that were highly successful, highly functioning alcoholics, and the games they played, and how they they skirted through for quite a long time. And then our podcasts I'm really excited about our podcast. We come out with new podcasts all the time, and we're talking with literally thought leaders across the country about the impact of substances with real-time issues. Everything from we've interviewed an insurance professional to talk about specifically how substance abuse impacts your claims, your medical claims and your benefit claims, to other people in the recovery community talking about cutting edge things. I know Palmetto EAP is really focused on innovation and new ideas, and our podcast is a great source of information for that. While people are thinking of their questions, Caitlin, I'm going to throw this out there. We've kind of hit high level on Youturn and how we work. If anybody on the call or anyone else that you want to put us in touch with, we're happy to do a little deeper dive, do a webinar with whoever the decision makers would be, or the key people within a company. Happy to show a demo of our website and dig in a little deeper than what we've done on this call.
Mm-hmm. And I've messed around with the website a little bit and been able to kind of like check it out myself. And I think it goes back to how are we getting information to our constituents. I know, Alan, you and I have had that conversation about what we're doing at Palmetto EAP is encouraging employees to like us on Facebook, like us on Twitter, so that they can start to have positive feedback in their feeds, so they can see tips for self-care, so they can see things when they pick up their phone, and it just becomes that sort of in between all the mess. You see that sort of light and that hope, and those are some of the ways that Palmetto EAP is innovating in regards to content. Because EAP, our Palmetto specifically, is definitely we've gone from a very old school place with EAPs, and we're really moving into the next century and the next decades, and how are we going to set up success for employees and the way that they consume information and the way that they access treatment. We've certainly, in some of the trainings we've done, we've said, okay, hey, can I chat with you? I'd feel much more comfortable if I just was able to chat on an electronic basis with counselors. We're really kind of doing what we need to do to make sure that we're providing those linkages, because I know my mission is to create access to treatment, and but our overall Palmetto EAP is just, our mission is to make sure that people are productive and that they're safe in the workplace. So, Annalyn, I want to thank you so much for joining us on the webinar today. If there are no other questions, we will go ahead and close out for the day. Annalyn, do you have any last thoughts?
I appreciate the time, the opportunity. I guess in closing, you mentioned what Palmetto's EAP's goal is. Our goal is just really to start the conversation and let people know that it's a safe topic to talk about. There are resources out there, and to get the ball rolling.
Right. And I had one question pop up, and I think this is really important to understand. So it says, at what point do we refer a client to Youturn if the program is unable to work with a client? And again, Youturn and Palmetto EAP would work sort of intermeshed, right? So like everybody in the organization would get the Youturn information, right? They're mandatory for making sure that you have this training, right? And so that's the access points with Youturn, right? So if that person has an issue and they could confidentially go to Youturn, we don't even know about it, right? Because they're getting taken care of, they're getting the education, they're getting the support that they need there. Of course, they can always call Palmetto if that's what if they want to access the counseling, and Youturn would connect back to Palmetto EAP for that EAP benefit, those 6-8 sessions, whatever sessions that you get. So it's an intermingling. It's not one or the other, right? So again, like I go back to that spectrum understanding, is that we meet people wherever they are in their motivation. And so this is a buffer. This is the thing that would help educate why you would need to engage in EAP. This would help educate how, and sometimes people just need a little bit of education to know that they may have an issue, and that where do I go at that point? So again, we're meeting people at all different levels. Does that answer the question?
Can I add something to that? I totally got so excited talking about other stuff. I didn't do a very good job of that segue. Yes, we recommend that if you partner with Youturn, that the training is mandatory. And what it does is it introduces all of your employees to our platform and to the way we talk and to the way we address substances. And what we have found many times, time and time again, is a company will log in, everyone will do the training. That's the only piece we report back to the company. If you mandate training, you tell us the training models that you're going to mandate, and we will tell you when everyone has taken the training. After that, we don't tell a client who's looking at what content. That's when the confidentiality factor kicks in. So what we find is companies mandate training, employees log in and do the training. Then usually for some reason, it seems to be about 45 days later, people will start to log back into the platform and they'll consume a little bit of content. And then 30 days later, they seem to log back in again. And what that tells us is there have been incidences. But when those incidences occur, then they're familiar with Youturn. They know that that's a resource. Then they're coming back in, and then they're consuming a lot more of the content and getting more and more educated. So the training piece, not only does it protect the company, it also introduces everybody to our platform and what we offer, so that when they have an issue, they then know where to go. Thank you
all so much for joining us today, and I hope that you have a great rest of the week.
Thank you so much. Have a great day, everybody.
Thanks, y'all.